Hello everyone, welcome back to this channel. In today's video, we'll learn about tocolytic drugs or tocolytic agents. Here is a pregnant woman with risk of having preterm labor. She went to a small clinic so the doctor prescribed her tocolytics. What are tocolytic drugs? Tocolytic drugs are used to delay preterm labor and delivery after 34 weeks gestation by suppressing the uterine contraction in order to improve the perinatal outcome. It is done to transfer the client to higher facility or administer medication such as corticosteroid to promote fetal lung maturation. Most commonly used tocolytics are calcium channel blocker like nifedipine, nicardipine, verapamil, magnesium sulfate, and NSAID like indomethacin, sulindac, beta-2 agonists like terbutaline, ritrodrine, isoxsuprine, oxytocin antagonist, atosiban, nitric oxide donor, glycerine, trinitrate. Mechanism of action of tocolytics. When tocolytics are administered, they cause smooth muscle relaxation in the uterus via different mechanisms. First, magnesium sulfate and calcium channel blocker like nifedipine blocks the calcium channel, which inhibits calcium and ions entry into the uterine muscle, thereby reducing their contractibility. Beta-2 agonists bind to the beta-2 receptor located at the smooth muscles, ultimately reducing the intracellular calcium, thereby causes muscle relaxation. An NSAID like indomethacin inhibit cyclooxygenase enzyme, leads to reduced synthesis of prostaglandin, thereby reduces the intracellular calcium and ultimately cause uterine muscle relaxation. Oxytocin antagonists block myometrial oxytocin receptor and ultimately inhibits myometrial contraction. GTN are smooth muscle relaxant. Side effects and precaution. Calcium channel blocker, hypotension, headache, flushing and nausea. Magnesium sulfate. Maternal side effects are flushing, headache and muscle weakness, rarely pulmonary edema. Neonatal side effects are lethargy, hypotonia, rarely respiratory depression, contraindicated in myasthenia gravis and impaired renal function. NSAID, maternal side effects are heartburn, asthma, GI bleed, thrombocytopenia, platelet dysfunction, contraindicated in hepatic disease, active peptic ulcer, coagulation disorder. Fetal side effects are constriction of ductus arteriosus due to inhibition of synthesis of prostaglandin, oligohydramnios, neonatal pulmonary hypertension, and IUGR. Beta-2 agonists. Maternal side effects are headache, palpitation, tachycardia, hypotension, ARDS, cardiac failure, hypokalemia, and even death. Fetal side effects are tachycardia, heart failure. Oxytocin antagonists, nausea, vomiting, and rarely chest pain. Thank you. If you like the video, you can share it with your friends. Subscribe to this channel for more videos.